Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss the pediatric relative MCQs. We'll see the first question. The most common cause of death in children under 5 years globally is options given below. Correct option is pneumonia. We'll move to the next one. Which reflex is present at birth but disappears by 4 to 6 months? These are the options here. Right answer is Moro reflex. Next question. Exclusive breastfeeding is recommended up to. These are the options given. Correct option is 6 months. Next question. First immunization given at birth in National Immunization Schedule is. Options given below. Here right option is BCG. We'll move to the next one. What is the normal heart rate of a newborn? Options are here. The right option is 100 to 160 beats per minute. Next question. The most accurate method of temperature measurement in children is. Options given below. Right option is rectal. Next question is the most common type of cerebral palsy is. These are the options. Right option is spastic. Next question. Fontanel closure time for anterior fontanel is. Options given. Option is 12 to 18 months. Next question. Incidence of febrile seizures is between ages. These are the options. Here right option is 6 months to 5 years. We'll move to the next one. The common sign of meningitis in children is. Options are here. The option is bulging fontanel. We'll move to the next one. A common cause of persistent diarrhea in children. Options given below. So is Giardia lamblia. Next question. Old child should be able to. These are the options. Sentences. This is the right option here. Next question. Measles vaccine is given at the age of. Options given below. Right option is 9 months. We'll move to the next question. Which congenital anomaly is commonly associated with polyhydramnios in pregnancy? These are the options here. And the right answer is duodenal atresia. We'll move to the next one. Which heart defect is characterized by a machine-like murmur in children? These are the options here. Right option is PDA, patent ductus arteriosus. We'll move to the next one. Increased risk of kernicterus when serum bilirubin exceeds. These are the options given. Right option is 20 mg per dl. We'll move to the next one. Which condition is characterized by a double bubble sign on abdominal X-ray? These are the options given. Right option is duodenal atresia. We'll move to the next question. Which of the following is the earliest clinical sign in a child with rickets? These are the options given. The right answer is craniotapes. We'll move to the next question. Which childhood tumor commonly crosses the midline? Here are the options. Option is neuroblastoma. We'll move to the next question. A child celiac disease should avoid which of the following? Options are here. Right option is barley. We'll move to the next question. Which vaccine is contraindicated in children with severe egg allergy? These are the options here. Right option is influenza. We'll move to the next question. What drug is commonly seen in? These are the options here. Right option is both A and C, that is kwashiorkor disease and also scarlet fever. Next question is most common type of seizures in children is, these are the options here. Right option is febrile seizure. Next question, the commonest cause of persistent fever in Kawasaki disease is, the right option is vasculitis. We'll move to the next one. The most reliable indicator of dehydration in infants is, options are here. It's weight loss. Thank you all. Please like, share, and subscribe to our YouTube channel for more informative content.